Hi, welcome to the lung page. Today we are going to see part 2 of the rapid revision of the chest X-ray 5 images in 5 minutes. So history is 60-year-old man presented with chest pain for 3 months duration. So what is your diagnosis of this chest X-ray? So we took a chest X-ray. We can see here, as we all know, it's ABCD order, airway completely normal and also bone normal. You can see very quickly, we can see the retrocardiac lesion. You can see behind the heart there is a air fluid level like lesions are there. This is called behind the retrocardiac air fluid levels are there with that small bulging, and you can't see the descending aorta clearly. So what is your diagnosis for this patient is hiatus hernia. So we all know this is hiatus hernia. Okay, understand? So number 7. 25-year-old male presented with 1 month history of fever and constitutional symptoms. So we took a chest X-ray. So what is a chest X-ray finding? As we all know, very quickly we can read ABCD order. We can see airway completely normal and bones everything is normal. Here the problem is in the lung field. You can see the tiny lung. There are some mottlings are there. So this is called miliary mottling. And also, this, according to the history, this patient presented with constitutional symptoms. So this is called miliary mottling. So diagnosis is miliary mottling and TB. So for further investigation, we have to do the Stupa AFP or gene expert, and if it is negative or positive, we have to treat, or otherwise we have to go for the HRCT just for the further diagnosis and further proceed with the bar for the further confirmation. For that is these are the another steps. Okay. So the eighth, very important chest X-ray. 60-year-old male presented with cough and constitutional symptoms for 3 months duration. We took a chest X-ray. So what is your diagnosis? You can see here. Here airway is normal, bones normal, cardiac contour is normal. You see the diaphragm, here diaphragm is normal, here its left diaphragm is little bit tended, okay, right. And also there's no effusion. You can see the lung field, this right side is normal. And also you can see the left side, haziness is there, okay, this little bit haziness there. And also you can see here is little bit prominent areas there. And also you can see very clearly here, what is this? This sign called loop sickle sign. Loop sickle sign. Okay. So this sign called loop sickle sign. Okay. And also you can see this is called very haziness there. So it's a very important chest X-ray. You can't miss this. This is called left upper lobe collapse. Okay. When left upper lobe collapse or left upper bronchus is obstructed, this left lower lobe is override and come and make as a there's a mark. This is called Leucical sign, and also this haziness called whale sign. When you put this whale during the wedding, the bride put this whale. This is called whale sign. So very important chest X-ray. So when you suspect this type of chest X-ray, you have to do the lateral view. When you see this lateral view here, there is a patchy opacity there. Almost always remember retrosternal spaces should be in the high pollution, so black. So here you can see this prominent mark, and this is a prominent white color. So this called left upper lobe collapse. So this called whale sign. Okay, now you clearly understand. So this is called whale sign or left upper lobe collapse. So what is the next chest X-ray? 40-year-old lady presented with cough for 2 months duration and 1 episode of hemoptysis. You can see this is a chest X-ray. As we all know, it ABCD order. Airway normal, bones normal, cardiac control is completely normal, and also you can see diaphragm is completely normal, and also no effusion. So as all you know, I previously told retrosternal space and retrocardiac space, descending aorta must visible in the chest X-ray. That is very important, and also dome of the diaphragm also should be visible. You can see here behind the heart there is some line is there. So this is cardiac line, and also this line is there, and also you can't see the descending aorta. Okay, so what is your diagnosis? And also you can see here this bronchial little bit cut off. Okay, so this is called left lower lobe collapse. or sale sign. So almost always remember, when you come across this type of chest X-ray, don't miss this subtle finding. Here you can see right lung is normal compared to the left lung. Left lung is a little bit volume loss. So these are the findings of left lower lobe collapse. So what is our next chest X-ray findings? 20-year-old male presented with recurrent low respiratory tract infection in the childhood. So we took a chest X-ray. As we all know, airway breathing, airway and also bone and cardiac control, airway is normal. Here you can see airway normal and lung field, everything is normal. You can see here, this is right side. So you can see the cardiac in the right side, okay? And also you can see gastric bubble also in the right side. So what is the diagnosis? And also you can see here there are a lot of bronchial markings are there and dilated bronchus are noted. So with 20-year-old male with recurrent childhood infection, so what is the chest X-ray findings are mainly situs inversus and also dextrocardia with bronchiectasis. So what is the diagnosis is cartilaginous syndrome. So what is the classic features or triad of cartilaginous syndrome? It's a bronchiectasis and chronic sinusitis and situs inversus. This is the main three uh, triad or classic triad of cartilaginous syndrome. Okay, we will meet in the next session of rapid challenge and rapid review. Bye.